Okay. Welcome, bienvenidos everyone. I'm Dr. Danielle Turner-Lloveras. I'm the president of SaludConTech, chair and founding member of the Latino Coalition Against COVID-19. Today we have an amazing person with us. If I was to give her bio, I would probably take up the entire length of this discussion, and so I will hold myself back. But it's great to have you with us, Sandra Hernández. The biography is so amazing, and you have so much experience in the world of health innovation, health equity, digital health. I wanted to first start off with if you could spend a little time explaining how you got to where you are today, and maybe tell us a little bit about what you're working on now.
Sure, Danielle. Honored to be here with you. Really, thank you for all the work that you've been doing in the COVID-19 space. Super important work, timely and relevant. So I'm a primary care trained internist. I came to San Francisco during the HIV epidemic and did primary care in San Francisco General Big County Hospital, serving essentially Medi-Cal and uninsured folk. And in doing the HIV work, you really couldn't do that work clinically without really connecting to the community. And so I've had the great opportunity of working with a lot of the FQHCs here in the city, and of course in the current role, they're such an important part of our infrastructure and our delivery system, and as close to the community really as we get. After residency, it was the HIV epidemic, and I had this extraordinary opportunity to work in public health. A lot of parallels to what we're doing now in COVID, right? Really trying to create these bridges between the community, HIV and AIDS education, working with grassroots organization, working with community leaders, and then really trying to connect that to the work we were doing in HIV. And at that time, we really, I'm dating myself, but we had no antiretrovirals at the time. So we're doing a lot of AIDS education, a lot of AIDS surveillance, and then eventually got into clinical trial work and really tried to figure out how we could create a community-based response to the HIV epidemic. So, fast forward, here we are, some 30 years later, we have a COVID pandemic. I have the great privilege of being the CEO of the California Healthcare Foundation and continuing the work of 30 years, really, where we are really focused on how do we make sure the healthcare system and creates the systematic changes necessary to create the outcomes and equitable outcomes for the Latino community and the Black community and the like, people who don't have historically good connectivity to this vast scientific enterprise that we have. California Healthcare Foundation is really focused on how to improve the Medi-Cal program. Serves 14 million people in the state, a lot of them Latinos and Latino families and young people, and making sure that program can take advantage of the innovations and the digital changes that can really have the promise, assuming that we have the right inputs and good community relations, to use the digital capabilities that the pandemic is forcing us to use today. So the connection between public health, the delivery system, and the community really is what I've done for my entire career, and really the California Healthcare Foundation very much working on that.
Excellent. Thank you for sharing that. You were talking about the connection between public health, the community, and the different stakeholders in creating these innovations. What do you see as sort of the greatest potential to improve healthcare in the Latino community when it comes to implementing technology in healthcare delivery?
Sure. Well, we have some challenges. We have some great opportunities, right? As always. I mean, broadband. We still have to get broadband widely available, and there are places still, rural areas and farm workers and the like, where we just don't have broadband. So that's a very fundamental piece. And while we don't particularly work in that space, it is fundamental to being able to do that. And then, of course, telehealth and telemedicine. I mean, one thing that COVID did was really unleash telemedicine and telehealth. Before that, we've tested it and piloted it and seen its value for example, in getting access to specialty care in places where we don't have specialists, where we don't have psychiatrists and we don't have nephrologists and the like. And so, telehealth and telemedicine now is being reimbursed in Medi-Cal. Super important, really important to understand. How do people use it? Where people feel safe about it? How do we think about it in the behavioral health space? And also, we have to go beyond audio, right? I mean, thus far in the Latino community, a lot of our telehealth and telemedicine work has been audio. We need to make sure that's audio and video, because there are places, of course, with video, it's necessary to be able to have telehealth be a real utility for folks.
Right. I successfully completed a very small pilot a few years ago, working with Medicaid, Spanish-speaking predominant Latino population. And one of the difficult things I found was I'd ask patients if they had internet access, and they would say no. And so when they told me that, basically, I couldn't invite them into the telehealth pilot. And then one of my patients I noticed had told me no. And then I saw him on WhatsApp on his phone. Oh. And I looked at the phone and I'm like, so you use WhatsApp? And he said, yes. I'm like, and you're able to use it in between your house and here without Wi-Fi? And he's like, right. I'm like, so you have internet? And that one, sort of blew my mind that we were asking the wrong question. And I think this is one of the questions that continues to be asked, that do you have internet? And if someone says no, we're assuming they understand the question, do you? Because, there's digital literacy is obviously a problem in immigrant communities and Latino communities. What are some ways you think we could help, those who are unable to embrace telehealth or have video visits? What are some ways that we could help them overcome these barriers in order to benefit from some of these innovations and be able to connect with their care team via video and audio?
Well, your story is a really powerful message, right? Number one, in early public health days, they teach you, never try to solve a problem for a community where the community themselves is not at the table, right? So this thing about the questions we ask, it's so important in any app and any technology and any tool, digital tool that we create, that we're doing it really with the users with us, right? That they're informing it, that they're, because otherwise we ask the wrong questions, right? We ask it from the places from which we sit, and we'll often miss great opportunities. I mean, your story, almost everybody has a phone. And so your point is super well taken in that regard. And so, my view of that is you got a lot of people developing a lot of applications and a lot of digital tools. The question really is, are they solving problems that are relevant to the communities that have not had good access? And then the bigger piece in this, Danielle, is we're still in the dark ages in sharing information and data easily and readily. So whether that's from a provider to a patient, in patient portals, or whether that's sharing that data from a population health point of view, whether that's sharing data across public health, we really do need to really create this infrastructure that's simple, that allows for information to flow across the delivery system, the public health system, to people's phones in a way that does not have all the friction and fragmentation, and you have to be able to do this to be able to do that. Right. So I think the sharing of data across digital platforms is a super important part of this effort.
I'm glad you brought that up. When it comes to sharing data, also not just encouraging sharing of data, but also encouraging adoption of practices where data is being shared. How can we promote collaboration among stakeholders for improving data sharing and improving adoption? And how can we ensure that we don't leave vulnerable communities behind when we're adopting these new technologies?
Yeah, it's a really important question, Danielle. And in California, there is now a digital infrastructure data exchange stakeholder group that's meeting and really looking at these issues. And, it's fascinating to me. People recognize how fragmented data is and how that hampers population outcomes and health outcomes. And yet there's a lot of inertia around sharing of that data. And I think those of us who are really interested in reducing disparities and improving outcomes need to sort of, we shouldn't allow them to take a sort of paternalistic view of this is my data, or, I'm not going to share this, or, I think what we ought to do is say, if people are really interested in health equity, and we're really interested in making sure that people have with different language access and different literacy, really have the ability to see that information flow across all of those systems in a fluid way. We have such digital capability, and yet the fragmentation and the kind of insular nature of the way people hold on to data, this data ought to be used in a way that is timely and relevant to the end user. And I think that vision is one we should advocate for in all the different capacities that we have. CHCF has got a lot of work in this space and think it's super important in terms of the journey to health equity.
Exactly. I also want to do a little bit of housekeeping for those in the audience. Please feel free to introduce yourself in the chat. Share your name, where you're from, what you're doing, what you're working on, what brought you here. We also have a Q&A section. If you have a question that you'd like to ask Sandra, please do type it into the Q&A section. We may share it on screen. We may ask you to come on stage and ask it yourself. If you're camera shy, that's fine. You can just ask the question and I will ask it for you. But please use that button there to place your questions, and feel free to introduce yourselves into the chat. Back to our conversation, you brought up stakeholders. Who do you feel are the key stakeholders when it comes to rolling out these technologies, say a telehealth program in a vulnerable community, or an app that may be used to improve diabetes? Who are the stakeholders you think that should be at the table?
Well, one thing that the California Healthcare Foundation has been working on, Danielle, is to identify. We have in the Latino community, for example, young entrepreneurs who are digital savvy, who are committed to addressing the inequities that exist in the Latino community and elsewhere. And I think it's really important that they get resourced and networked and lifted up so that they are, in a position to be able to receive the kind of funding they need to take those ideas and innovations into the Medicaid program and to scale them. And so, really finding the network of young Latinos, and not even such young Latinos, but innovators, people who see problems and have lived experience and have a view about how they might be able to address them. They're the voice that have really been, scratching for very little dollars. And I think that one of the things we're trying to do is identify those networks and those individuals, resource them, network them, and really get those innovations to be able to get the kind of resources they need to scale. So that's one. And then two is, we have an amazing workforce of promotores who, have a lot of trust in the community. They are very firsthand. They know a lot of these issues personally. And I think they're a very important asset to our team, right, to our healthcare team, because they create connectivity where hospitals don't often, right? And certainly, our academic medical centers really struggle there in a tertiary role. And so that's another area that I think is super important. And then, the workforce of Latinos for a state as diverse as ours is just, it's paltry. I mean, we really need to work on expanding workforce capabilities at all levels, right? Not just physicians, but nurse practitioners and midwives and nurses, et cetera. So I think we need to keep a real eye on a limited workforce, and one, by the way, that's been ridiculously stressed during the COVID pandemic. So I think, part of this is how do we all shoulder up to make sure that the bridges that we're trying to build take advantage of the knowledge and skills and trust and relationships that have been built, and that we create that infrastructure that allows for the information to flow and allows us to develop digital capabilities that actually work for folks.
And this infrastructure, how do you see, how can systems be designed to address the unique needs of vulnerable communities? What about the infrastructure or the system would you, in the ideal state, should have?
Yeah, that's a great question. Well, look, I'm a primary care trained internist. So if I say anything other than primary care, bad on me, right? We really don't have a preventive orientation, a primary care orientation, a wellness orientation to how we think about, our health outcomes as a community. We saw that during the pandemic, right? There are all kinds of economic issues around where people work and essential workers and the like. And so, to me, this question of, what would the ideal system look like? Well, we should have ready access to primary care that's team-based, right? And, if you don't need a doc and you can do something with a nurse practitioner or with a promotora, we should use all of those assets in a way that is not competitive with one another, and use the limited resources that we have, specialty care and the like, to try to use telehealth to get that reach in places where, it's hard to reach. Not only do we have a workforce shortage and not a lot of language capability and cultural capability there, but we also have a maldistribution geographically, and we have a lot of community that sits in rural areas and farm workers and the like. And so I think we need to really sort of say, how do we leverage those team-based care, use everybody at the top of their license? And there's a lot of effort in that regard right now, but the status quo has, strong proponents, and so we've got to advocate for that. And then lastly, I mentioned this at the outset, Danielle, 13, 14 million people in Medi-Cal and growing in the governor's budget, right? Now everybody should be covered, right? We need to get everybody in. And so strengthening the Medi-Cal program, the state has a very bold plan under CalAIM to strengthen that program in a way that really does make sense, and that really does sort of look at a whole person and doesn't fragment behavioral health from physical health. And all of those fragmentations do not serve our community well, or other communities for that matter. So I think there is a real need to share data, to use all of the assets of the workforce that we have while we're building the pipeline for more, because we're a growing population and we have huge gaps and a lot of catch up to do there.
Exactly. I know I believe we have 2 minutes left. I wanted to bring up a question from the audience. Anikia Nelson has a question, if we can show that on screen here. How do we increase collection of self-reported race and ethnicity data for use by providers and payers to increase health equity? Are there particular considerations for Latinx communities?
Yeah, that's a great question. Thank you, Anika, for that. It's really important to get race and ethnicity data. And it is important that it is self-reported and that we don't make assumptions based on names or the like about what someone's race or ethnicity is. And it's very hard to move the agenda on health equity if you don't actually have that data and aren't tracking it in real time. So accurate data, self-reported data, and really disaggregating the data so that we can understand the distinctions, because Latino community is not a homogeneous community. People come from different parts of the world. Their immigration patterns are different. Their food is different. And so I do think it's important for us to disaggregate the data that we do collect and be much more systematic about collecting it and having it be accurate and actionable, right? Why collect data that you're not able to act on? So I do think it's a very important piece of the data collection and data sharing that we need to be able to do. And it's certainly very important in our population health work as well.
Exactly. I believe we have about 2-3 minutes left, but I wanted to ask you, is there anything that you wanted to share with the audience on the topic of digital health equity, which is a very broad topic, but are there any last thoughts on where you think next steps are in regards to building digital health equity in our communities?
Yeah, I mean, I think we need to build it and be super mindful, right? I mean, there's a lot of data warehousing now, and there's a lot of conversation about AI and artificial intelligence and what does that mean. And I think what we need to do is we both need to be very proactive and really advocate for digital tools that work to reduce inequities in health and disparities in health, both in access and in outcomes. But we also need to make sure that the data that's in these systems now don't work against us, right? And I think that's a horizon that we should keep an eye on, because there will be a lot of AI use. There's now AI being used in depression medication and depression treatments and the like. And so we need to make sure both that the data that goes in there and how it's used and the questions that it's used for really does address health equities and not perpetuate some of the structural issues that are in the system now that embed a lot of bias. And so I think while we're being proactive and we've got a lot of ground and a lot of opportunity in the digital space, we also need to make sure that data is used in a way that addresses our public health needs, our population needs, and a lot of chronic disease management as well.
Right. I know that the data collection has been a struggle this entire pandemic, and I feel that when the data, with quantification is how we tell our stories. Without the data, then people become invisible and the stories aren't heard. And so I completely agree that the data needs to be collected better. I know we're also working with a group called We Must Count, which is a coalition of organizations working on ways of improving data collection, because without that, it's hard to focus on where our resources need most and where should we put our efforts to really bring equity in our distribution of resources, tests, and treatments. Sandra?
Yeah, I would just say, if the COVID epidemic taught us anything, right, it's this notion that the sharing of data across these systems is completely broken. And so shame on us if we don't take this opportunity to say this needs to be fixed and really think about what the vision for that is. And I want to thank you and your organization, all the coalitions that you're working on for your leadership and advocacy in that arena.
Well, thank you so much, Sandra. We're just reflecting off of you and your organization, the work that you're doing, and look forward to hearing more about the innovations coming from the groups that you're working with in the innovation, the CHCF Innovation Fund. And thank you once again for joining, and hope to see you soon again in the future event.
Happy to be with you. If anything I can do to be helpful, let me know. Cuídate. Thank you, Danielle.
All right, cuídate.
Okay, bye-bye.